evening, everyone. Thank you for being here. The journal club today is obviously about dermatology. We are going to look at a couple of papers, and the presentation obviously will be recorded. Therefore, you should be able to access to this presentation later if you cannot join us right now. We are going to look at a couple of papers. None of them is a specifically is a landmark, at least at this stage. I found them quite interesting because they look at a couple of topics that are quite intriguing, both from the clinical side of things and from the more likely research aspect of dermatology. They are both from the Journal of Veterinary Dermatology, and the first one is an investigation into the clinical efficacy of a spray based on heat-treated lactobacilli in canine atopic dermatitis. This is a preliminary open-label uncontrolled study performed by colleagues in the University of Florida, and was very recently published. The background, as we know, generally speaking, is that canine atopic dermatitis is a relatively common inflammatory and pruritic skin disease. And especially in relation to canine cases, fortunately, we have various treatment options. In the last few years, although there are good medications available as oral or injectable, we try to focus also on treatment with topical products, because we know that addressing eventual skin barrier defects or addressing microbial overgrowth is an important part of dealing with this condition. And we know that the pathogenesis is made of several problems, including some genetic and immune system alterations, along with defects of the skin barrier. And more recently, it has been demonstrated that you have also modifications on the cutaneous macroflora in atopic individuals. Looking at studies in humans, there are reports of the potential positive effects of topical application of substances that contain killed bacteria. In particular, the type of bacteria that have been used are mostly type of lactobacilli bacteria, and according to the human studies, they have been reported to show a significant decrease in the clinical signs, which means, for example, a decrease in the level of erythema, lichenification, or eventually alopecia excoriations caused by self-trauma, and pruritus. This has been shown both in atopic people and in mice, in obviously experimental animals. The other thing that was demonstrated in these preliminary studies is the overall reduction in population of Staphylococcus aureus, which is the most important pathogen present on the skin of atopic individuals. We are talking about humans. But this was demonstrated in one study. Additionally, other studies report that, again, the application of these formulations containing rapidly killed bacteria can improve the clinical signs of human atopic dermatitis and stimulate the local immunity. So the objective of this study was essentially to evaluate the effects of a spray containing the heat-killed lactobacilli type of bacteria on both the clinical signs and on the cutaneous microbiota, which means the investigators have been evaluating the level of pruritus, the type of skin lesions, and eventually the composition of the microbiota pre and post application. The primary outcome, so the main aim, was to establish whether you have an effect on the clinical signs, and the secondary outcomes, whether you have an effect on the skin barrier and on the cutaneous microbiota. The study, as I mentioned, is very small. There were only 10 dogs enrolled, They were dogs affected by non-seasonal variant of atopic dermatitis. They were privately owned and mildly affected. As you see, there is no control placebo in this case. The exclusion criteria were any dog with evidence of history of malignant neoplasia, with metabolic or endocrine disorders, or with parasitic diseases, or other allergic conditions other than atopic dermatitis. Therefore, dogs, for example, with proven food hypersensitivity were excluded. Other patients excluded were the one with already superficial infections. And again, the evaluation of the microbiota means evaluate the bacterial population normally present on the skin pre and post without any evidence of clinical infection. There were, during the period, obviously, it was important that dogs were not on treatment with specific drugs. For instance, dogs that had received oral and topical antibiotic or antifungal agent had to be off for 4 weeks before being enrolled. Dog had to be off corticosteroids for 8 weeks in case of deposit injectable steroids, 4 weeks for oral steroids, and 3 weeks for topical steroids. The withdrawal time for antihistamines was 2 weeks, and for cyclosporin, 4 weeks. Additionally, the most recent molecule used to treat dogs with atopic disease had to be withdrawn, obviously to evaluate the effects in terms of pruritus. And the withdrawal time was 8 weeks for lokivetmab, which is Cytopoint, an injectable drug given as a routine roughly every 4 weeks, and oclacitinib, which is Apoquel given orally. The withdrawal time for oclacitinib was only 1 week. This is due to the very, very short half-life of this drug and very, very quick clearance from the body. In addition, if dogs were receiving allergen-specific immunotherapy, they were admitted only if they had had it for less than 1 year before the enrollment. Dogs that had had the immunotherapy for less than 1 year before the enrollment were excluded, which means it's okay if a dog has been on treatment for more than a year, because that is a condition of stability for the dog. But if the dog was still in a sort of induction phase, was not used to evaluate the effects of this spray. In terms of method and material, I'm just going quickly through this. I guess is not absolutely relevant at this stage, but as I said, is a water-based spray containing a mixture of these bacteria called lactobacilli, and there were other metabolites produced by them and some extracts. The process of heat killing was used is called tyndalization, and is essentially performed by reaching boiling point for 15 minutes for 3 consecutive days. And this methodology essentially can sort of kill the bacteria, but at the same time doesn't degrade it in a major way the bacterial wall. And this is important because bacterial wall might have an immunological action on the skin, and you don't want to alterate the potential immunological action. The spray was applied once a day for 28 days. And the clinical scores, which means evaluation of criteria such as erythema, alopecia, or excoriations, and lichenification, which is the thickening of the skin secondary to inflammation and self-trauma, was evaluated, as well as the skin barrier function, which was addressed by specific measurements on day 0, day 14, day 28, and day 42. Therefore, it's over a period of nearly 6 weeks. The evaluation of the bacteria present on the skin was analyzed obviously before, so day 0 and day 28. This was done by means of PCR. It's important obviously to remember and highlight that other topical agents, no matter what their use, were not allowed during the study. We said we had 10 dogs, 5 male, 5 females. The average age was 5.3. Plus or less 3.6 years, and the average weight was 28.2, but you see there was quite a big variation here, plus or less 24 kilograms. And in fact, if you look at the breeds, you might see that you have large dogs such as Great Danes, but you have also smaller breeds, for example, French Bulldogs and Jack Russell Terrier. And by looking at the results, as we said, the clinical scores were evaluated at different points. And it is interesting to notice that a reduction in the clinical score, which means a reduction in the severity of features, again, such as erythema, alopecia, lichenification, excoriation, were noticed to decrease starting from day 14 going into day 42. And there were some reduction noted also specifically in the clinical regional scores. They evaluate also the level of pruritus by a different scale called visual analog score scale, and the reduction was noted throughout the period, and statistically a significant reduction was noted at day 42, which means towards the end of the trial. In terms of hydration, they noted a lower hydration on day 28 and day 42, but this was noted only on the ERP. Overall, there was what was described a good to excellent response, and in terms of changing the clinical scores, and the clients reported an easy to use administration, which is always very important, especially considering that most of the treatment, especially with atopic dogs, is done at home by the owners. So it's important the ease of use, ease of administration. An interesting point, especially comparing to the previous study mentioned in humans, is that actually when they looked at the cutaneous microbiota before and after the treatment, which was done after 28 days, no changes were found, which means the application of these heat-killed bacteria didn't seem to cause any change in the bacterial population on the skin before and after. So if we look at the conclusions and clinical importance, yes, I think it's interesting to see that there was a significant and rapid decrease in the clinical signs associated, which is ultimately what we want. We shouldn't forget that pathogenesis of atopic disease is still not 100% understood in canine patients, and therefore the ultimate aim of doing a treatment, no matter what happens in the skin, is that we improve the clinical signs, and by doing that we improve the quality of life of our patients. And therefore, at least in this very small study, there was a significant rapid decrease in the clinical signs associated. But obviously, despite the study is interesting and has been published on an important journal, it's important obviously to highlight that we definitely need other studies, and not only a larger size of the samples, but also we need a randomized control study to confirm these results. And the authors commented on the absence of changes in the microbiota. So they said, yes, it is possible that these bacteria do not interfere with the cutaneous microbiota, but they might have an effect on the local and systemic immune response, because obviously we had a decrease in the pruritus level. And there are studies showing this beneficial effect with using killed bacteria, because the application of killed bacteria on the skin seems to be beneficial on one side, but at the same time doesn't seem to have the potential drawbacks of putting live microorganisms on the skin. The limitations, again, are based on the very small number of dogs, the variety of breed, as well as the short treatment period. Obviously, again, is important to look at this study with a larger double-blinded, and I think it's quite important, and I'm sure you all agree that a placebo-controlled study should be done, perhaps using a spray that contains same vehicle, obviously without the heat-killed bacteria, so you can evaluate whether the beneficial effect is actually truly due to the bacteria or to something else. So this was the first presentation. Again, definitely not a landmark study, but an interesting topic, especially given that not only we, as I said earlier, we are focusing on topical therapy, but also on the appeal that topical and sort of natural type of treatment the appeal that this kind of treatment have nowadays also on clients. The second study that I would like to present, really nice. Again, is similar to the previous one. Is a study that definitely needs to be reviewed and to be done on a larger scale. But it's quite interesting because especially when we work in a referral setting with multidisciplinary setting, we often see patients that go from one service to the other because of comorbidities. And I found very intriguing to find out whether the conditions have any link and whether by acting on one condition you can ameliorate the clinical signs of the other condition. So the title of the study is a higher prevalence of seizure activity in a small population of atopic dog. And this was a retrospective breed and age match study conducted at the University of Vienna. Again, published very recently. What is the background? Background is that atopic dermatitis is considered a systemic disease in people, and because it involves multiple apparatus, and in humans, it has been shown that there is a potential association with epilepsy. No association have been investigated so far between epilepsy and atopic disease in dogs. So the objectives of the study were to investigate whether there is an increased incidence of epilepsy in atopic dogs. To do this investigation, they did a retrospective study looking at matching breed and age in two different groups. So it's a case control study. They prepared a standardized questionnaire, which was presented to owners. And again, we have two groups, dogs with atopic dermatitis and dog without atopic dermatitis. The dog with atopic dermatitis were selected via were selected, and then once selected via a database, so they went through the university database, they selected the affected dogs, and then the client were submitted a questionnaire which was completed over the phone. And obviously, very importantly, seizure-associated signs were collected and reported based on what the owner reported. That's quite relevant, which means this population wasn't necessarily a population of dogs that had undergone examination and diagnosis by a veterinary neurologist. They selected about 100 patients. Breed and age matched dogs were searched separately, and another questionnaire was given to the matching dogs without history or without diagnosis of atopic dermatitis. And what they wanted to calculate is the odds ratio calculated between dogs having seizures in the atopic dermatitis group versus the control group. And this was defined as the primary outcome. Essentially, the primary outcome is to find out whether dogs with atopic disease had a higher incidence of epilepsy compared to the dog without atopic dermatitis. They looked also at potential other conditions. So the questionnaire was developed in a way that you could find out whether, again, not necessarily diagnosed by a specialist, but whether these dogs had clinical signs suggestive, or they had been already diagnosed with comorbidities, for instance, heart disease or something similar. The number of dogs were 34, and in both groups. So you had 34 atopic dogs and 34 breed and age range matched non-atopic dogs. The clients owned dogs with atopic disease were selected looking at the medical records in a time span from 2010 to 2017 at the University College, and the recruitment. The diagnosis of atopic disease was done, as we always do, based on clinical signs, exclusion of other pruritic diseases, and the performance of a food trial without improvement during the food trial. And this is what we do generally. This is the way you diagnose atopic dermatitis. You don't do specific tests other than excluding the other diseases and focus on the clinical manifestations. As we said earlier, this dog had to go through a food trial. They decided to include dogs with coexisting food allergy, which means maybe dogs that were atopic, but were also showing reactions to food, which could be part of the atopic disease. Another important thing is that the person contacting the owners was not involved in patient care, and they didn't know the full medical record of the dog. So they just went through the set of questions blindly. The owners were asked via email first if they were willing to participate to a health-related study, and no emphasis was made on the atopic dermatitis or eventually on the presence of epilepsy in these dogs. The control group was recruited during events such as training camps, dog show, or training facilities. Again, the owner were asked about the breed and age of their dogs in terms of find out whether they could be used for the matching, but no other information were requested in order to participate to the study. Obviously, if the dogs were identified as being atopic, they were excluded from the study, because obviously this was the group, the non-atopic group. The recruitment happened in a shorter time span. This time we are talking about 2016 to 2017, so it's only 1 year versus 7 years before. And looking at the results, it appears that within the atopic dog, 7 out of 34 also suffered from seizure activity. By contrast, in the non-atopic group, only 1 dog was affected by seizures. Looking at the statistics, essentially the atopic dermatitis group was associated to a higher degree frequency of seizures than the atopic dog. Than the non-atopic dog. And no other comorbidities were detected in the non-atopic or in the atopic dog group. So essentially the outcome from this small study is that, at least according to these results, there was an association between seizure activity and atopic status, and the incidence of seizures in the healthy control group was 3%, while in the atopic group was 21%, so a 7-fold higher. So we had a 7-fold greater risk for atopic dogs to develop seizures activity versus the non-atopic dogs. In terms of discussion, obviously you go in and you have a look. You go and have a look at the pathogenesis of the conditions, and what we know is that obviously we don't know whether there is a mechanism connecting atopic dermatitis with seizures, and actually we don't know the full etiopathogenesis and pathophysiology of both diseases. So presumably mechanisms that can explain a causality between the seizures and the atopic in the seizures in the atopic individuals involves obviously the presence of inflammation. Inflammation mainly deriving by inflammatory cells and their cytokines. Essentially, what happens is that we know that atopic individuals have flare-ups, and when they have a flare, they have systemic inflammation. One of the theories is that the presence of this systemic inflammation could affect the blood barrier and the cytokine milieu that reaches the brain. So, for example, in epileptic people, elevated levels of specific mediators, such as interleukin 17 and interleukin 1 beta, have been shown to be present. And there is a correlation between these cytokines and the seizure frequency. Studies in mice have shown the overexpression of another cytokine called interleukin 6 in the brain of transgenic mice, and this has led to predisposition for seizures in this specific population of mice. So it would be nice to extrapolate these features from studies in humans and mice and say that, yes, actually, maybe the same thing happened in dogs. And yes, it's absolutely possible. However, it's quite interesting to notice that the potential seizure triggering cells, which are called the T helper Th1 and other pro-inflammatory cytokines, yes, are detected in dogs with atopic dermatitis, but actually we know that dogs with atopic dermatitis develop other type of cells and cytokines, specifically Th2 and their derived cytokines. So this doesn't really match completely with what has been found in people. However, we don't know, because obviously dogs are not all the same. There are lots of endotypes, and the genetic of atopic disease in a breed might be different from the genetic of atopic disease in another breed. It is possible that if we look at overall a different population of dogs, maybe we have a predominance of Th17 driven inflammation, which is the same type of inflammation that has been shown to trigger seizures in people. And a possible explanation is that with time, atopic people and dogs switch to a different type of response, which at a later stage can somehow be responsible for the seizures. And yeah, another thing that, again, just to highlight again, is that systemic inflammation has been shown to induce temporal lobe epilepsy and lead to an impaired blood barrier, contributing to changes in the cytokines. Again, if you have systemic inflammation, you have impairment in the blood barrier, and you can have somehow cytokines and inflammatory mediators reaching the brain. So as a result of this, it's possible that cells producing cytokines can be connected with both diseases. And these cells include mast cells, and we know they are involved in skin inflammation. And additionally, we know that other types of cells, for example, macrophages, might also play a role in development of epilepsy and atopic dermatitis. And if the upregulated inflammatory cells and cytokine produced in individual induce neuroinflammation, then they can obviously lead to seizures. In terms of discussion, one other thing that the authors reported is that in other inflammatory diseases, not necessarily atopic dermatitis, for example, autoimmune conditions such as systemic lupus erythematosus or type 1 diabetes, you can have an association with development of epilepsy, strengthening the plausible inflammatory connection. Therefore, it is possible, or it seems, that chronic allergic disease might cause seizures with a common pathway that trigger both diseases, the inflammation in the brain and the inflammation, in this case, on the skin. As we mentioned, this study has also some limitations. First of all, is a retrospective study in nature, and again, we have a limited number of patients, which is a common trait when we present at least preliminary studies in veterinary dermatology. We have always the issue of having limited patients, limited patient number. The other thing is that because the patients enrolled didn't go necessarily through a screening via a veterinary neurologist, we didn't know a lot about what was the diagnostic approach and what kind of epilepsy was diagnosed. So we essentially based on everything on clinical signs of seizures in these dogs. Another limitation is that these conditions, epilepsy and atopic dermatitis, are both chronic. They can present for years, and potentially in these cases, we don't know if somehow there was no medical record going back to the beginning, and therefore the study was not able to provide data on a timeline of disease onset between the two conditions. And what we know is that ideally the data should have been collected in a prospective way with a longitudinal study. And another important thing to consider is that somehow we don't know if patients that had atopic dermatitis were going at a later stage to develop also epilepsy. Therefore, some patients in the atopic dermatitis group without clinical signs of epilepsy potentially could have been part of the dogs with the epilepsy, therefore increasing the incidence of the condition, if the study had been done prospectively over a longer period of time. So in terms of conclusion and clinical importance, we say that this is a small retrospective study which highlighted the increased prevalence of seizure activity in a population of atopic dogs versus a population of non-atopic dogs. But further larger and prospective studies are needed. And the study ideally should be done prospectively, longitudinally, following the patients over a period of time. And ideally, the diagnosis both of atopic disease and of epilepsy should be done by veterinary neurologists and dermatologists. So I hope you didn't get too bored with the presentation. I guess I went very quickly, so apologies if I've been talking too fast. And I hope you enjoyed the message. I think again it's quite interesting, especially the one, the last paper. And please, if you have any questions, I'm here. Thank you.